Hello, so welcome again to this channel, Mental Health with Dr. N. So today I want us to go straight and look at the reason for this channel, or the essence of this channel, which is talking about the importance of mental health. Okay, in your own mind, what does mental health mean to you? What does it look like to you? For yourself, for others, what does mental health look like to you? I want us to reflect a bit about what our health in general means to us. I know many a times, many of us will probably take it for granted, take our health for granted, but a simple reflection for a minute will tell us that it is one of our greatest assets, if not the greatest. Think about your aspirations. Think about your goals. Think about your productivity, and think about what you mean to others. For example, what support you are able to offer to others, either within your family, within your wider social context, or society as a whole. Think about it, and think about what difference will be made in all of these areas if, for example, you wanted to do all of this, but you are not able to, simply because your health was not optimum. Health might mean different things to us. Okay, we might define it differently, but I want us to have a common basis for looking at health. And that is why I chose to use the definition given by the World Health Organization, who have defined health to mean a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Physical, mental, and social well-being. So they have clearly identified certain domains wherein there should be optimum functioning, certain domains that should be optimum for an individual to be in a state of health. Talked about the physical domain, the mental domain, and then the social domain. And then again, if we reflect on all of this, we've come to find that each of these domains, there is actually interplay between each of these domains. All right. For example, the state of physical health might impact upon a person's state of mental health, and vice versa. So, again, looking at that definition, we'll find that if we take out the element of mental health, therefore, there is no health. So we say that there is no health without mental health. So for us to be in a state of health, sound health, we need to also be in a state of sound mental health. Which brings me again to the issue of mental health. What would you say that mental health is to you? And conversely, what is mental unwellness to you? How do you, when we think about someone who is mentally unwell or mentally disordered, what comes to our mind? I've asked this question in a few fora, in schools, in even hospital settings, or in religious gatherings, and people have come up with different answers. And I think I have a common denominator amongst these answers. It might interest you to know that many a time people don't even know that certain conditions which are clinically diagnosable as mental unwellness or mental disorders, many people don't consider them as such within the society. People tend to look at the more enduring mental disorders, the more psychotic disorders as what they would call mental unwellness. Well, again, going back to the World Health Organization, the WHO, they actually have a definition for what is considered a mental disorder. And I'll prefer that we'll go with their definition for the purpose of having a common denominator to express ourselves on this channel. The World Health Organization has said that for us to say that somebody who is mentally disordered or is mentally unwell, and therefore there is an absent state of mental health, an individual should have some significant disturbance, right, in the person's cognition, in the person's emotional regulation, or in the person's behavior. And that this disturbance in the person's cognition, emotional regulation, or behavior is causing the person significant distress or impacting upon important areas of functioning. So, explaining this in simple terms, if you find that an individual has a change, a negative change, a downward change, an adverse change in the way the person acquires knowledge and understanding, that's what they call the WHO called cognition. The way we acquire knowledge and understanding is called cognition. In other words, our thinking processes, our judgment, our day-to-day experiences. These are some of the things we call cognition. The way we gather our memory is also included in what we call cognition. So if there are significant disturbances in these areas, or in the person's emotional regulation, for example, a person's emotions become out of context, what you call depression, for example, or anxiety, for example, especially when they are sustained. And then again, there are also disturbances in a person's behavior. Usually they become out of context. And these changes, these disturbances are causing this individual distress. The person is suffering because of this change that has taken place. Or this change that has taken place in cognition, in emotional regulation, or in behavior has impacted upon certain important areas of functioning. Then we say that such a person has mental unwellness or a mental disorder. And important areas of functioning could be something like a person's job, either being able to keep a job or being able to be productive at work, or a person's schooling, academic performance, or even within a relationship, such as a marriage, for example. All right, being able to function in these areas appropriately. If there is a problem with that, then we can say that such an individual is mentally unwell or mentally disordered. Who can be affected by a mental disorder? I think the summary of that is to say that anybody could come down with a mental disorder. Anybody. Especially when we look at, again, the statistics that is available to us. It says that 1 in every 8 persons worldwide has some form of mental disorder or the other. There are diverse kinds of mental disorders, diverse kinds. So if we put all of these together, 1 in 8 persons worldwide is suffering from one form of mental disorder or the other. Now, if 1 in 8 persons is suffering from one form of mental disorder or the other, that means that probably somebody listening to this video now, or someone you know, possibly a family member, a member of your religious gathering, or a colleague at work or at school, might be having a mental health condition or a mental disorder, and therefore be mentally unwell. And again, it also carries another implication, that mental disorders could cut across any age group. Children, young adults, older adults, anyone could come down with mental disorders. Okay, so I think any condition that has this element of statistics related to it, or these figures related to it, is worth thinking about. It's worth spending time to talk about, which I think is why we will be looking at these disorders going forward. Mental disorders have caused a whole lot, or they cause a whole lot of disabilities worldwide, a whole lot of affectation of functioning in people worldwide. the impact upon people's functioning, the impact upon people's sense of well-being, and the impact upon people being able to achieve their goals or being able to be of help and of benefit both to themselves and to society. So when we think about all of these, we think that we need to take a second look at them, be able to identify them, be able to provide appropriate support to people, and even if we can't provide support directly ourselves, be able to signpost people to appropriate places of help. So because of these factors that we've just discussed in this short clip, we'll be taking a closer look at different aspects of mental disorders as we go forward. Thank you for listening.